Hello everyone and welcome to this webinar on hormonal acne. So I wanted to do the regular typing and then you read the lessons, but then on a second thought I want to do a video so you can see me, you hear my voice, and then in fact you feel the teaching. So firstly, I'm going to be talking about what acne is. Acne is a common skin condition that occurs when the hair follicles become clogged with oil and dead cells. This often results to the formation of pimples, blackheads, whiteheads, cysts, and so on. I know you understand what blackheads are and what whiteheads are. Now, acne is most prevalent during puberty due to hormonal changes, but it can also affect people of all ages. Even after your puberty, you can still experience acne. Facts such as genetics, hormonal fluctuation, and some certain medication and your lifestyle choices can also contribute to the development of acne. So there are also some skincare practices that you do that can also contribute to you getting acne. Sometimes your face might just react to a particular skincare product, even your lifestyle adjustments. And some severe cases, there are also medications that can lead to you having or getting or experiencing acne. Now, hormonal acne especially is usually triggered by fluctuating hormones. It could be due to menstruation. You know, women during their menstruation we experience hormonal fluctuation, so you can experience acne. Okay, so me, for an instance, I do experience acne, like severe, very big master big. Okay, so me now, for example, I do experience big acne during my menstruation. This is due to hormonal fluctuation. Now, pregnant women can also experience acne, women that are close to their menopause. Also, women who have polycystic ovarian syndrome can also experience stubborn acne. So, it can also occur after taking or stopping an oral contraceptive. Hormonal acne can also be genetic. You heard me right, can be genetic, especially if your mom experienced hormonal acne. It's possible that she can pass it on to you through her genes. So yes, I have experienced acne and I am still experiencing acne, and this is because my mom also dealt with hormonal acne, but I've learned and I'm still learning how to manage it. So of a truth, hormonal acne can be genetic. So if it's something that your mom experienced, there's every possibility that you too might experience hormonal acne. If your parents had skin problems, chances are you too, you will also have it. For example, genetics might also determine how well your immune system can react to some of these skincare products. Can also determine how your immune system reacts to pimples, acne, skin bacteria that can cause acne. Genetics can also determine that. So genetics also play a very big role on how easily your pores are clogged. Yes, genetics can also can play a role. That is why treating hormonal acne alone is not effective for relieving stubborn acne. So if you're just treating hormonal balance and all that, it might not be really effective if you are experiencing stubborn acne. Okay, so there's something called androgens. Androgens are thought to be male hormones, but actually they are found in both male and female. So these androgens are being produced by the adrenal gland, and they are produced by adrenal gland as well as the testes and the ovaries. So the most well-known androgens are the testosterone, and it breaks down a product called DHT, dihydrotestosterone. So let me not bore you with all the biology stuff. Let me talk straight on what this androgen does. So what does this have to do with acne? So androgens have the ability to bind with oil gland in your skin, and it can tell the oil gland to produce more sebum. Yes, sebum. This excess oil, sebum, sebum, this excess oil combines with the dead skins on your body, and it also combines with the debris and bacteria to cause you or to form pimples on your face, or to cause acne sometimes on your chest. Because this excess oil combines with dead cells and bacteria to cause pimple, that is why it produces a result whereby you experience skin irritation, redness, and acne. And that's why if you have tried various over-the-counter lotion, serum to treat acne, and it's not really working, or you have not noticed much improvement, the truth is that it's not your fault, because most over-the-counter remedies are usually not successful with handling hormonal acne. This is because hormonal acne typically takes the form of cystic bumps. Yeah. So these bumps form deep into the skin, and they are usually out of reach of most lotions and serum, because they are actually very deep into the skin, and the lotions and the serum you apply are not able to reach to the bumps to take care of them. So I don't know if I should really call this a myth or a misconception, but I think this is one of the mistakes or some of the things people don't really know. So one of the myths or misconception is that if you balance your hormones, you'll be able to clear your acne. Now, the truth is that acne is a skin condition, it's not a hormonal condition. So it's not something that, okay, once you balance your hormones, everything is going to be all right. Yes, fluctuating hormones can trigger acne, and a healthy hormone can improve your skin, but treating acne requires multi-pronged approach. So to totally get a clear skin, you have to also treat your skin and avoid some certain foods that can trigger acne, and also be very big in learning stress management. Learn how to manage your stress and follow some nutritional regimen for skin enhancing nutrients. Second mistake is you can cure hormones. You can cure hormonal acne with birth control pills. Yes, doctors often prescribe birth control pills, IUDs, implants, and some shots as a means to control acne. But here's the problem. Only high estrogen birth control pills can actually help you with your acne. Everything else is an acne trigger. Low dose of estrogen contraceptive tend to increase androgen levels. Remember what I talked about, what I said about androgen, and think of it as a trigger. Think of it like should I say vice versa. As estrogen goes down, androgen goes up. So in addition, birth control is just suppressing the acne. So as soon as you come off the pill, the acne now comes back with full force. Yes, there are medications. I know you might be surprised to hear that doctors prescribe birth control pills, but yes, there are some medications that doctors usually prescribe for stubborn acne. Yes, of course. If you need to take oral contraceptives, there are some that will not cause acne breakouts. Ask your doctor for contraceptive pills that are high in estrogen and low in androgen potency. Your doctor can help you with that. Now, thirdly, we are going to be talking about the third myth or misconception about acne is that you should spot treat with benzoperoxide. You should have heard about benzoperoxide if you're dealing with stubborn acne. Now, spot treatment means like you just drop it like. Okay, so I had to go and bring my next to them to show you what spot treatment means. So people believe that spot treating with benzoperoxide is going to deal with the acne. Spot treatment means like just spot on that acne part, you put a spot, and then you put a spot, and then you leave the whole face. So the truth is that benzoperoxide is best best used all over your skin, like in a way to prevent acne. Don't just spot treat, rub it all over your face. When you use benzoyl peroxide to spot treat your breakouts, you are not treating the microcomedians. I'll spell it out. So you're not treating the main thing. The future acne, they are still there. Like they will start forming under your skin. So benzoyl peroxide is best used and as an overall treatment because it will penetrate through the surface of your skin and kill the microcomedon. Yes, microcomedon, and kill the microcomedon. So the microcomedon can actually form under the skin up to 90 days before they come up to the surface of your skin. So a 90 days regime of using benzoyl peroxide, if it is recommended, 90 days of using it is going to make sure everything is clear from your inside, from the inside of your pores out, in addition to the acne that can be visible, in addition to acne that are already on your face. This benzoyl peroxide is going to clear them from inside out. Now let's talk about talked about it for a second, fourth myth or misconception. Okay, so the last misconception I'm going to be talking about before I go into other important details is the fact that you're taking supplements, and then you're taking some supplement and you feel like you're not supposed to be experiencing acne, hormonal acne. So I take supplements, and at times, sometimes I experience breakouts too. So there are just sometimes that you cannot control some of the things that happen in your body, especially when it is related to your hormones. So the truth is that there are some supplements that still trigger acne. There's a way to take these supplements and it's going to work for you, and there's a way to take these supplements and you're just going to end up triggering your hormones to give you the worst results. So I'm going to be talking about some of these vitamins if time pleases, but then let's talk about some of the triggers of hormonal acne. So I've said it that the best way to treat hormonal acne is to take a comprehensive whole body approach. In other words, you have to treat your acne from the inside out, as well as treat your outside. Also treat your inside and avoid some triggers. Like I'm teaching you about this hormonal acne, it doesn't mean that once I'll not break out. So the best way to treat hormones is to take a comprehensive whole body approach. In other words, you have to treat hormones from the inside out. Like as you're treating your outside, you're also treating your inside, and avoid some certain triggers that can make acne worse. What we eat, the things we eat, it's very important. They can trigger hormonal acne. They can trigger even just acne that doesn't have to do with hormones. They can trigger acne. Let me use the word acne. Now, some of the things that can trigger acne include soy, meat, whey protein powder. So this food can alter your hormones because they contain some certain hormones. I think I've said this before. They can alter your hormones because they contain some hormones. Dairy, especially cow milk, can cause acne because of its high level of iodine. I feel like I've said this before. So stress fuels acne. Stress fuels acne because it activates the adrenal gland to produce extra androgen hormones. That is why we experience more acne, especially students who are overstressed. You experience acne breakouts, unless God blesses you with a very good skin that no matter the matter, your skin still shine. So thoroughly digestive problem. Do you know that the health of your intestinal tract is linked to the health of your skin? Yes, the health of your intestinal tract. Poor gut health can not only cause digestive problems, can also increase inflammation in your skin. So the more inflammation in your body, the worse your acne becomes. You see, gut health don't joke with it. GUT health, GUT, the gut health, very important. I don't know if you're going to read about or say anything about acne without mentioning the gut health. The gut health is very important. Even some most times when your gut health is messed up, it can lead to you contracting some infections. There are infections like yeast infection that can be caused due to poor gut health. So yes, gut health is very, very important. Like as I'm saying gut, sounded like gut. So your gut health is very, very important. And what is gut health? This learning is going to be a very long one, but I'm going to try as much as possible to start summarizing now. So let me talk about the most important things. But then let me just pinpoint or say some few things of what the gut health is. So the last and the second supplement I'm going to be talking about for the purpose of this class is fish oil, omega-3 fatty acid. I read about omega fatty acid on my Facebook timeline some days back. Omega-3 fatty acid, it's very good and it has natural anti-inflammatory properties. Since inflammation is at the core when you're experiencing acne, taking fish oil with high level of omega-3 is one of the best things you can do for yourself when you're experiencing hormonal acne. It's one of the best things, as I was saying, one of the best things that you're going to do for yourself. Not only do this essential fatty acid in omega-3 oil benefits your skin by smoothing and soothing your body inflammation response to excess sebum and bacteria, they also help you to reduce the action of BGE2 and LTB4, two inflammation chemicals that are responsible for acne breakouts. So what's more, they help regulate the action of acne causing hormones, yes, such as testosterone and androgen, which I've talked about. So these two supplements which I've talked about, I talked about omega-3 fatty acid and probiotics are very, very important. These are some of the supplements you should add to your healthcare routine if you're always experiencing hormonal acne or breakouts or pimples, whitehead, blackheads. These two supplements are going to help you.